Welcome back to The Blend. It's the #1 cause of death in the United States. Cardiovascular disease affects so many people, and with this being American Heart Month, we want to shed some light on how you can keep your heart healthy and happy.
Here to talk about the ways to stay heart healthy, Dr. John Bedotto, Healthcare Partners of Nevada Cardiologist. Good morning and welcome.
Good morning.
Welcome.
Well, you are a cardiologist, and you know recently someone had a heart attack eating at that one burger joint that we've been talking about here on the news for a while. Can one burger really kill you?
Well, let's look at what's in that hamburger. So you've got, what, 3 patties, bacon, white bread, probably some French fries with salt on them, and a soda. So if you look at the top, what, 5 or 6 bad things to eat, they're pretty much in all of them.
Yeah.
You got trans fats in your,
there's
French
lard
fries.
involved,
Oh
too.
yeah. Plus you've got white flour, you've got high fructose corn syrup in your Coke, you've got salt on your fries, you've got sugar, you've got pretty much everything, and then obviously high saturated fat meal in your hamburger. So could you have a heart attack with one? I mean, it's
if you're
possible.
on the edge, it's a possibility.
If you're on the edge, I mean, you got to look at sort of the two parts of it. I mean, there's the long-term consequence of eating that way your whole life.
Yeah.
And there's a short-term consequence. When you have a high-fat meal, it does do things to your body instantly. I mean, you do get changes in the way your arteries transport nutrients across the vessels. Plus, you get your blood shunt into your intestines to digest the food. So there is the short-term effect. So you have to look at it both ways.
Is it okay to have it occasionally? Is this something that's like once in every 3 months?
I would say that an 8,000 calorie meal at one sitting is probably never good to have on any occasion. I mean, I'm not a food Nazi. I mean, small amounts of meat and things are very good.
Yeah.
But an 8,000 calorie, high fat, high meal that's got a lot of salt on it is not good for you anytime.
Yeah. And just to let people know, the guy did not have to pay for that meal.
No, well, yeah.
Well, if you weigh 350 pounds, you never
he's
have to pay
paying just in a different way.
Yeah, he's paying in a different way right now. But let's talk about heart disease. How prevalent is it, and what are some of the signs and symptoms?
Well, I mean, it's the #1 killer in men and women, and by far the #1 killer in women. And it's very prevalent, especially in this society where people don't eat healthy or exercise, and they have other bad habits,
very
smoking
sedentary.
and such. Yes, yes.
Now, what are the steps to preventing heart disease? Obviously, not having 8,000 calorie meals will probably help.
Yeah, I mean, there's a lot of little things that people can do. There's a lot of little things you can do to make yourself healthy. Exercising on a daily basis, depending whether you're trying to get cardiovascular health or lose weight, 30 to 60 minutes a day, some type of aerobic exercise and or strength training.
Doesn't take much.
It doesn't. You can do it not in one sitting. You can break it up throughout the day, and that's really important. Obviously, if you smoke, stop smoking, and then eat a diet that's high in nutrients and low in calories, and those are mostly vegetables and fruits and nuts that grow on trees, olive oil, things like that, and then lean meats are actually healthy too.
If you're going down this unhealthy track and you have problems, you're seeing your doctor, can it be easily reversible?
It can be reversible. There's been lots of studies that show now that you can actually reverse the amount of plaque in your arteries by getting very low cholesterol values. There was a study done recently that showed about 60 to 70% of people actually going to have plaque regression, so yes, you can.
At what point should we be seeing a cardiologist? Or is there any warning sign that we'd have to see? Or?
Yeah, I mean, the warning signs can be subtle. I'm getting out of breath more than you should when you're doing routine exercises. Chest discomfort. It's not always a chest pain. Sometimes it's just an uncomfortable feeling in your chest or neck or arms or back, especially if you're exercising. And if you just aren't sure, it's good to get checked out because a lot of the symptoms are subtle. I know doctors that stayed home with what they thought were ulcers and had heart attacks. So it is sometimes not obvious.
And let's say your family members have heart problems, your parents do. Are you more likely to get it as well?
Yeah, there's more of a genetic predisposition to it, but it doesn't mean you're going to have to get it.
But the tips for preventing heart disease, one more time, go through them.
Well, I mean, it's having normal blood pressure, having a low cholesterol level, eating a healthy diet, not smoking, and then there's a lot of other little things that you can do. I mean, social things, I mean, enjoying a meal with your family, those are all things that actually help prevent heart disease.
And then heart attacks. When it comes to a heart attack, what are the symptoms of a heart attack? How do we feel when coming on?
Yeah, the symptoms usually start with some type of discomfort in your chest, your upper chest that goes into your neck or jaw or arms or back. Sometimes be associated with shortness of breath or sweating or nausea.
And for women, do we get the same signs as men?
They can be a little bit more subtle. I mean, the fact is that most women that have heart attacks do have chest pain like men, but sometimes the symptoms are a bit more subtle, sometimes just trouble breathing or breaking out in sweat when you shouldn't.
Doctor, it's a pleasure.
Thank you for joining us this morning. Again, Dr. Bedotto's office is located on West Sunset Boulevard. For more information, call the number or check out the website on your screen, and you can see these heart healthy tips on our website at vegasmorningblend.com.